You're listening to Being Built. I'm Aaron Davis, your host. I'm here with JD Whitlock. Welcome to the show.
Good afternoon. Glad to be
JD,
here.
as a kind of a point of intro, you're the CIO of Dayton Children's Hospital. That's how I know you. And you've been involved in leading the local technology industry organization or being part of that, part of the leadership team there. And so I've gotten to know you at events and such. Glad to have you here to chat about what you do.
Glad to be here.
So you were briefing me a little bit on a few of the things that you do. Sounds like you're a busy man. 3, 4, 5, the list goes on and on. We'll hit a couple of things that I could tell you're really passionate about. But obviously running the technology suite, the whole kind of infrastructure and the systems at Dayton Children's is your bread and butter.
Right.
And then you do a little healthcare consulting, a little marketing consulting. And then you mentioned something about the electoral process reform. That was kind of intriguing.
Yeah, we'll talk about that.
That's a hot item too. So so tell us a little bit about what you're focused on, what you're building these days.
Sure. So I am blessed to be Chief Information Officer at Dayton Children's. Mm-hmm. It's an honor to work in healthcare generally, and then a children's hospital. As our Chief Medical Officer says, if you can't get behind the mission of a children's hospital, you probably don't have a soul.
Right.
So, every day I can be, if I do a better job, then our doctors and nurses can take better care of our patients, and the sick and sometimes very sick kids in our hospital get better. And so I've been in healthcare for 25 years now, and I've started out in the Air Force Medical Service. Then I was with Mercy down in Cincinnati. And so now for 5 years, I've been at Dayton Children's. And so what that looks like is the IT department at Dayton Children's is 125 people.
Okay.
And that's roughly split between half and half between what you would, if anybody is in IT, what you would think of as a normal IT department, all the normal IT things that would be in other companies you would recognize from other companies, service desk and infrastructure and operations, and PMO and cybersecurity, ERP. And then the other 50% is, as is common in health systems today, are a team that does heavy configuration on our electronic health record.
Yeah, Epic, like everybody else in the neighborhood, right?
Like everybody else in the neighborhood. Ohio is very heavily Epic, which is great because it makes the interoperability a little bit better.
You're all the hospitals locally are training the whole workforce.
Kettering, Premier, Dayton Children's, really everybody of any health system, any size in Ohio is on Epic. University Hospitals in Cleveland was the last significant system to not be on Epic, and now they're going on.
Interesting. Yeah. Okay. Yeah. So that's news to me. That's cool.
Yeah. So what that means is there's a good there's a lot of labor around. Some occasionally people will find an opportunity for that first supervisory position in another health system, and people move around a little bit. And Epic has a very nice certification system. So if you are certified to work on Epic Ambulatory, Epic Inpatient, you understand hiring people that they know what they're doing because they have that certification.
Gotcha.
So it's optimization of a platform. It's a development platform. So we're not developing software, but it's heavy configuration. And the bad thing is Epic gives you enough rope to hang yourself if you're not careful. So there are bad implementations of Epic, and then it makes it life difficult for the doctors and nurses and other clinicians that are using Epic. We would like to think that we do a pretty good job at that, and backed up by the fact that we take part in a national survey of EHR satisfaction, and we score in the 90th percentiles.
Okay, so who's measuring who in that?
So that is a national collaborative group that we're a part of that makes sure that the survey is done correctly.
Okay,
and then you're comparing yourself to other health systems that are taking the same survey. Hundreds of health systems are doing it. Not everyone's on Epic.
Okay,
but it's a good benchmark.
Yeah.
So we have good governance. So there's always more to do than we have time to do. But people that have, for example, I would like Epic to do this thing differently. If your requested optimization didn't get prioritized at the top, and it's not going to get done or not going to get done soon, at least there's a fair process that where the right people, the right clinicians, not the IT folks, get together and prioritize things.
So in that governance process, that's always intrigued me. I've been part of those in the past, committees or teams around both as a vendor and as an acquisitions team. So or an implementation team. So is there clarity in your we don't need to spend the whole conversation talking about this, but is there clarity in the process for the stakeholder to understand the rationale for the deprioritization? So like you say no, do they get the feedback as to why?
Yes, hopefully. If someone is submitting something, we have a voting membership on these different committees. But if somebody is suggesting something that's not on the committee, they can come in and make their case, and so I'd say it's pretty transparent.
That's good.
And then the other thing we're always trying to do is there's a saying not unique to Epic, but we like to say it a lot in the Epic ecosystem of all the health systems that are on Epic is imitate to innovate.
Okay.
So probably someone else has built that thing that you ought to be using before. Yeah. And it's a really good knowledge management platform that Epic uses. People get on there and say, hey, we're having this problem. What has everybody else done? And somebody else has something helpful for that. You go to the conferences. They have big conferences up in Madison, Wisconsin, where they're headquartered every year. And they do a nice job of cherry picking the best innovation that other people have done. And there's a culture of sharing.
Nice. Amongst the healthcare community, amongst the provider community. Okay.
Yes. Nice. In fact, on a rare occasions when people do try to actually make some money off of the things that they built in Epic, that's people look down their nose at you. Okay. Try to do that.
Yeah. And only Epic's allowed to make money on Epic, but nobody else.
Exactly. There you go. It's funny. People get sometimes people will get bent out of shape about that. Like I did something and Epic put it in the system for everybody else. That's good. That's the way it's supposed to work.
That's a win for the patient. It is.
Right? And something like I think it's 19 of the top 20 hospital systems in the U.S. as ranked by U.S. News and World Report, which some people think is a good way of doing it. Some people don't, but for whatever that's worth, are on Epic. So there's definitely it's an interesting story of a female entrepreneur that started Epic 43 years ago, never took outside money, never went public.
Interesting.
And had a strong vision for the patient being at the center of the health record. And so it's a good story. We're happy that we're on Epic, and we do. And even though Dayton Children's is on the very small end of Epic customers. So like a really small rural hospital is not going to be on Epic. Like a critical access hospital is not going to be on Epic because you have to have a certain amount of resources to really
just to make it
do
worth it.
Well. Yeah. So Dayton Children's is a $600 million revenue, which is not a small company, but in health system terms, it's a small company.
Gotcha.
And so we're not doing a whole lot of truly groundbreaking things, but we are through this community, we are able to deliver really top-notch care because we're sort of leveraging all these best practices that people are doing. Now, there's a few areas we have done some innovative work. One of the that half of our IT team that is doing this Epic configuration, a lot of them are clinicians, nurses, pharmacists that bring all their clinical expertise into the work that they're doing configuring Epic. In fact, we recently started doing the oncology module of Epic, and it just so happened that we had 2 former oncology nurses working on our team that they could then start building that part of the tool.
Interesting.
Anyways, one of the nurses on our team decided that we needed a better acuity system on the inpatient, and what that means is measuring how resource intensive different patients are in the hospital, so that when the next patient comes on the floor, you have two nurses that are already taking care of three patients, and one of them's going to get a fourth patient to take care of, which nurse should get that based on the acuity of the three they're already taking.
So the demand of each patient is not all equal, right?
Exactly.
So, okay.
And there were some adult models that had been built for that, but nobody had yet built a good pediatric model for that. And so one of the folks on our team built that, and our clinicians liked it, and we presented, and then we went and presented at the Epic conference, and the other pediatric hospitals said, "Oh, that's great. Can we borrow that?"
Okay.
Something else cool we're working on is
so monetizing that is just off the table. Sorry, my capitalist brain.
Like I
coming
said,
back to that same conversation.
The culture is not to do that. But I mean, I think if everybody did that, then it'd be like
slow down the
1,000 cuts. You would absolutely slow down the innovation. Yeah. It's funny in healthcare. If you're really only competing with the people next door to you. So Kettering and Premier are fierce, competitors. When I was at Mercy, fierce competitors with TriHealth and UC, but everybody else,
they're colleagues and friends, and they're all part of the same community, the same network. Yeah,
exactly.
Cool. It's an interesting culture.
It is. Yeah. Have you heard about social determinants of health?
Yes, I've been in conversations, or I've been around in the room when those conversations we're having.
Yeah, so there's growing recognition that we really need to pay more attention to all these social determinants that affect patients, particularly patients in lower socioeconomic status, and the fact that what happens in the doctor's office is an infinitesimally small fraction of their life.
Sure,
and if we want to really care for the whole person. And in accountable care models where health systems, as they should be, are increasingly incented to keep patients healthy and out of the hospital instead of just get paid when they come to the hospital.
That's right. Former guest and I were talking about some data work he was doing around exactly that. It's a kind of a conversion from fee for service to
exactly
kind of outcome based.
And it's very difficult to do because you're really turning the whole economic model on its head.
That's right.
But it's the right thing to do. And but anyways, in that model, all this social determinants work becomes more important. And we've been doing a lot of that. A lot of people are talking about it. Not a lot of people are actually doing it. We are doing it at Dayton Children's. And we have a Center for Health Equity that is focused on that. We have care coordinators and social workers that spend a lot of time on this. So we have social determinants questionnaires that patient families can take. Typically, not exclusively, but typically families that are on Medicaid. And about half of our patients are on Medicaid because of the Children's Health Insurance Program.
Oh, right. Okay.
And so anyways, what that looks like is we have these questionnaires. Maybe they identify that there has some food insecurity, and then our social worker can go into our EHR and say, okay, this patient needs their kid just got diagnosed with diabetes. We're doing some education for them. They live in a food desert. And here's a food pantry that's a mile from their home with one click, because the EHR is integrated with a system that has information on all the community benefit organizations. And so we're just making it a little bit easier for our clinicians to help our patients out with those kinds of things. And something innovative that we are doing there is, in a perfect world, every patient family has taken one of these questionnaires. But in the real world, that doesn't really happen.
Right.
And so because we have a relatively small primary care footprint where we're administering those surveys, but most of the patients are coming into our emergency room. They're seeing other pediatricians in the community that are not on Epic. So a lot of times we can have some critically ill kids that are relatively new to Dayton Children's, and we have not had time to administer that survey. Then what we can do is take the address, geocode it, map it to a census tract. And so census tracts being smaller than zip codes, because you can't do this at the zip code level, because within zip codes, you can have very different neighborhoods, very different socioeconomic neighborhoods.
Worked in real estate for a while. There's a few neighborhoods in the region where within a block, you've got kind of A grade or B plus grade properties. right next to C- properties. So.
Exactly. And so some academic researchers put together this thing called Child Opportunity Index that takes all that socioeconomic scoring that the government does, and then buckets that into things that are meaningful for pediatric care. So there's a like a health and environmental focus, there's an educational focus, there's a sort of overall socioeconomic focus, and then there's one that buckets all of those. And so we can then use that. We're just implementing this now, but we can then use that both in our analytics at a population level and do some interesting studies on that, and how should we do our interventions, our like neighborhood interventions, and where are our patients coming from that have these issues, and how do those scores correlate with some of the disease states that we see.
Interesting.
And then also do it at an individual patient level. Yeah. And actually, nobody has done that yet. Is used this particular pediatric focused socioeconomic scores. There's an adult one. The adult medicine always happens first because they're
safer to mess with.
They're just bigger. Yeah, they're just more. But pediatrics is sort of the second fiddle for some of this stuff. It makes sense it's second, but it shouldn't be forgotten, obviously.
Right.
And so the pediatric community, advocates for these tools being available and then implementing them. So all the pediatrics community that are on Epic we're actually going up to visit some of the senior folks at Epic next month to talk about those things, like how can we as a pediatric community better ask the Epic developers to build things to support pediatrics with some groupthink, the good kind of groupthink.
Right.
So what are
not really the kind that knows every kind of initiative.
Most important things, weird things that you wouldn't think of. That adolescent privacy is mind-bendingly complex thing where, for example, access into the patient portals, and every different state has different ages at which an adolescent has the privacy rights to kick their parents out of their patient portal. So that has to be implemented differently.
Wow.
You have to be very sensitive to these things. So that 14-year-old that has the legal right to kick mom and dad out, but can't drive to the appointment yet.
Interesting.
How do you handle that? Well, you handle that by having a different flavor of the patient portal access that shows mom and dad when the appointment is, but doesn't show mom and dad the notes from that appointment.
Wow, what about the implications of a hospital that's in a on a border where half the population is in one jurisdiction and half's in another? I'm just thinking about the level of complexity, and that's just one of a trillion things, right?
One of a trillion things, and some of the privacy laws. Europe has done this GDPR thing. California's done its own thing. What's not going to be doable is every state comes up with a new privacy law. It would be it'd be impossible for not just healthcare, for all businesses to do. So that screams out for some sort of national
standard. Yeah. Wow, what a trip. Yeah, as you were talking about the determinants of health outcomes, I was thinking about the outcome-based payments. Obviously lends to more efficient healthcare services. I've got a guest coming in a couple of weeks talking about her startup, which is it's called Sure Impact. And as I understand it, it's something that has an outcome-based measurement of social services, I think. I don't know. I'm going to explore that with her. I'm looking forward to that. But that might be a point of interest that we can share as well.
Yeah. A lot of incredible innovation going on out there. The challenge is, and this is what my consulting practice focuses on, is helping people with good ideas actually make things work in healthcare in a commercializable way, and understanding who is actually going to be interested in that and who can use that and how we can integrate that into clinical workflow.
That's a great segue into your consulting practice then. Do you find that kind of applicable implementation in a large health system is the challenge? Like, what is the biggest difficulty that you're running into when you're helping these startups and such?
So our health system, so the economics behind our health system are crazy complex, right? And it would be nice if they weren't that way, but they are. That's sort of the reality of our health system. And so you have to have more than just a good idea. And what tends to happen in healthcare venture capital is you have a bored billionaire in the Bay Area that likes to write people $10 million checks before breakfast to go transform healthcare. Sure. And then you have really earnest people that are going to go transform healthcare with $10 million in their pocket. And they come up with some good idea that'll never, ever work. So part of it is who's actually going to buy that and implement it, given the way that the money works in healthcare.
Okay.
Number two is you may have a good idea, it may be affordable, somebody may want to pay for it, but it's not going to be usable by doctors and nurses if it's not integrated into their clinical workflow. And that clinical workflow is in the EHR. So you have to integrate it with the EHR. And so you have to think about that. And with the advancement of better APIs in and out of EHRs, which the government has played a positive role in standardizing some of those APIs. And so that's made it a lot easier just in the last few years than it was previously. But that's something else I've seen. Like, we can take your data out and do some fancy analytics on it and give you some fancy risk score. Okay, how are you going to get that to the doctor at the point of care? Well, we haven't figured that part out yet. Well, that's useless.
Just drive over here and look at it on paper.
Yeah, right.
Right. So you do a little bit of healthcare consulting, right? Appreciate you touching on that. You do a couple of other things too. Is it okay if we
sure.
discuss some of those things too? So you do a little bit of marketing consulting?
So my wife and I, when we became empty nesters a couple years ago, we decided to move downtown Dayton.
Okay.
And we are happy residents of downtown Dayton with all the awesome restaurants and bars we can walk to in 10 minutes in the last, 5 years. We managed to time the movement to April 2020 when the pandemic started.
Everything shut down.
So the walking to all the bars and restaurants had to take a little bit of delay. I found myself in the situation of no soccer games to go to anymore.
Right.
No lawn work to do anymore because we lived in a townhome, and some time on my hands and tuition bills to pay. So I was reading about the arcade hub going in.
I was just there last week.
A beautiful place. What a great story for Dayton, and if you haven't seen have you seen those Awakening the Giant documentary pieces?
No.
Oh, they're brilliant. You have to watch that. So I was reading about that and thinking, it would be fun to do something entrepreneurial, hobby entrepreneurial, not real entrepreneur. Real entrepreneurs quit their jobs and start something else.
Right.
That's not me. I'm a hobby entrepreneur, but I thought I had done some web development in the early days of WordPress. I played around with some things, and what I like about the web development side of things, it's half techie and half really creative stuff,
sure.
and business strategy.
Okay.
I thought, what, I could start something, have a little office down there, have some University of Dayton students as interns because, of course, University of Dayton's doing their entrepreneurial programs down there. And so I decided to do this. And my wife said to me, so we've been married for 25 years. You've never, ever said anything about doing anything entrepreneurial. I'm like, well, why not? So what came out of that was a very small, very part-time internet marketing agency.
Okay.
And I found a little niche for myself in some of the business networking that I do through, do you know BNI, Business Networking International? Yeah. So I'm in this really awesome BNI group that's sort of become family. We get together once a week with other small business owners. And I realized there's a niche for small business owners that need some internet marketing but don't have the money to go pay bigger
big agencies
that are going to charge them lots of money for sometimes they need a simple website. They need an attractive, mobile responsive, secure website.
Right. And that can be pretty lightweight these days.
And so with WordPress and the appropriate WordPress plugins to do the
Mhm.
things that you need to do.
Yeah.
And then some lightweight social media management, and then some search engine optimization.
Okay.
So I can deliver that in a sort of a lower priced subscription model.
Nice.
And so I do some of that. It's kind of
That's awesome.
fun thing. Yeah.
You know what I find is that as you get into, I guess maybe the last, I don't know how long, 10 plus years I've been more in management than in doing stuff, right? That you kind of miss getting your hands dirty a little bit, and it's fun to just build something.
Right. Absolutely.
Right? And so I'm trying to think, I was building something physical the other day. I'm trying to remember what it was. Oh, I built a little knife throwing board that my stepfather and I were going to play around with. And so it's a fun little wood project or whatever. And I after tinkering with that, I felt this kind of satisfaction that you don't often feel when you're pushing emails around.
You're right. Exactly.
So,
Absolutely.
or you're having negotiations or whatever else you do for business, right?
Absolutely.
But actually kind of doing the work is fun. Not that leadership's not its own job. It is.
Sure.
But it's just harder to see a real clear, measurable, like I did that.
Absolutely.
When you impact somebody's life, which is maybe the most satisfying thing, it's always some degree of influence. It's hard to measure. You don't always even know.
Right. You're right.
Right. That you're doing. You're just kind of trusting that you are. But it's fun to build something, though. It's fun to kind of look back and say, "Hey, I put that together. That's cool. Hey, check this out."
Yeah, exactly. And the business strategy part of that is fun too. So I've got just a couple handfuls of customers, but everybody's doing something different. In fact, one of the things I put in my contracts is if you hire me to help you out, I won't work with one of your competitors, one of your local competitors.
That's generous.
Which means that I only have one plumbing customer.
Right. That's cool. That's really cool.
Yes, but that's a.
I might introduce you to my little brother. He runs a hardwood flooring company.
Oh yeah.
And you mentioned plumber, and then that's the kind of person who's either out on the road or whatever else, and you don't have time to tinker with website stuff, right? You've got your own like technical competency or whatever that you have to focus on and build. And so that's a kind of a great service that you provide for somebody who just doesn't have the desk. To mess with that kind of stuff.
Yep.
That's cool.
Yeah, and competing against that company that's the medium size instead of the small.
Yeah.
That has that
does
going
have that
on,
back office.
You may that your business may fail if you kick, because that's just the way people find.
That's right.
If you need a plumber, you take out your phone.
A plumber certainly doesn't need a big heavy invoice, every quarter or whatever for some custom build or whatever. That's too much. So we've kind of jumped through a couple of your passions, and you mentioned something before we started recording about electoral reform.
Yes.
It was kind of intriguing. So how'd you, and I was tempted to kind of unpack all of that, but we waited. So I have no idea what you're about to say, but
sure. Yeah. So
this might be our first controversial take on the Being Built podcast.
Hopefully this is not controversial.
No, let's hear about it.
Well,
curious what you got into.
The people that would object to this are the totalitarians on either side of the political spectrum. So I don't know how many of those, out of your thousands of listeners, how many of those you have. I have been a political independent since forever. Never really identified with either political party. Okay. And as I've watched, what's happened recently with the hyper partisanship going on in Congress, and Congress has something like a 15% approval rating among Americans.
Sure.
And I don't think I have to convince anybody that Congress is like utterly dysfunctional. Okay. Right. And so one thing that would help is if we can have more elections that are decided in November instead of where a lot of congressional elections are decided in the spring in the primaries, where the only people that vote are the fringe voters that are voting for the fringe candidates. Okay. And so that's why we have hyperpartisanship. So the combination of gerrymandering, of packing, and more recently with now the data tools we have available, the gerrymandering gets worse and worse. Sure, right?
Because it's more effective.
It's more effective. Exactly. And so, what can we do about that? Well, every state controls how the elections are done in their state.
Sure.
And so Alaska has already done this. Nevada has already done this. You have in the primaries, you have a top 4 or 5. 5 is the best way of doing it for various reasons. People go to the primary. You don't get a Republican ballot or a Democratic ballot. You get all the candidates running, and you vote for your choice. And the top 5 go through to November, to the election in November. Then you do ranked choice voting. And so in order to win, you have to get over 50%. And if nobody gets 50%, then you take the candidates with the least votes, and you take those votes away from them. They drop out, and then the second choice gets the votes. And that happens over and over until somebody gets 50%.
Okay. So in ranked choices, I understand it, everybody chooses where they rank each of the candidates. Exactly. So you get a 1 to 5 scale.
Yes, I skipped that part of the actual voting. Thank you for pointing that out.
I wasn't sure I understood it correctly.
That's how you get that data. I should have pointed that out explicitly. Right. So that's why you have the first, second, third choice, fourth, fifth. If there's 5 candidates, 1, 2, 3, 4, 5. And so if your number 1 is on the bottom and votes get reapportioned, then your vote goes to your number 2.
Gotcha. Yeah.
Until somebody gets to 50%. What that does is it lets people vote for who they really want to vote for
instead of who they think
can win.
Mm-hmm.
And also it just lets more moderate candidates get on the ballot in the first place.
Yeah.
So I think that's a way to go, that if we can get this on the ballot in Ohio, I'm working on Rank to Vote Ohio is the organization that I'm doing some volunteer work with. Also, Veterans for Political Innovation is another group. That's a national group. And so we're advocating for these, for doing this and hopefully getting something on the ballot in 2024.
Interesting.
That would, of course, not affect the voting in 2024, would affect in 2026, right, hopefully. Yeah. But, if we can get that on the ballot, when you think about it, like the only people that are going to really be against it are some of the, because the Republicans control the state house in Ohio. And did you see in the news today, the former Speaker of the House it just got booted out for he was so corrupt, he actually got booted out by the
interesting.
by the Republicans.
Okay.
So
no, I didn't catch the news.
If you're a true believer Republican and then maybe you would not want that. Okay. But all the moderates and the Democrats are going to, because they're not holding power. Some of the fringiest Democrats would also not want it because, in the districts that are gerrymandered into being Democrat,
mm-hmm.
they want to have the most progressive candidate.
Okay.
And this would maybe get more. So maybe some of them would be against it too. But the bottom line is the 70 to 80% of us in the middle
mm-hmm.
are going to vote for this.
Mm. So Alaska has adopted it, and Nevada has adopted it.
Nevada has adopted it. Yeah.
Interesting.
Mm-hmm.
Okay. Yeah. Have they held elections yet?
They have. Yes.
Under
mm-hmm.
those terms. Okay.
Mm-hmm. Yeah.
What kind of problems did they run into? I wonder.
Well,
usually when something's new, you have to flush a few bugs out, right?
Apparently it's gone. That's gone pretty well.
Okay, good. Mm-hmm. That's cool. Mm-hmm. Yeah, it's interesting. The idea of a broader set of choices, more realistic reach to a broader set of choices in electoral politics is appealing, I think, to everybody, except for those who hold a certain kind of power that's compromised with that kind of move. So
right.
That's interesting. Yeah, we'll keep our eye on that for sure. That might be something worth watching the news for.
Definitely.
The news for.
Mm-hmm.
Cool. Well, man, you've got your hands in a lot of different things between, building websites for small businesses and doing some kind of like consulting for high-tech companies trying to build innovations in healthcare.
Yeah.
And then
by the way, I should have mentioned, I'm not doing all the website building.
No.
I found another. So
you got some people.
I took my CIO skills of knowing how to evaluate talent in other people.
Okay.
And figuring out how to put that team together.
Okay.
And you're familiar with Upwork?
Yeah.
Okay. So I went on Upwork.
Uh-huh.
I looked at some portfolios that other folks had done. So I work with a young woman in Pakistan who's a full-up developer. I work with a young man in Poland
Okay.
who is a WordPress developer, comes at it from a design perspective. Was a graphic designer first.
Okay. See, here I'm picturing you're dragging and dropping boxes.
I do a little bit of that.
Okay.
I do a little bit of that, just enough to be dangerous.
Yeah.
And then also a woman who's a Ukrainian who's currently living in Poland, who's been doing technical SEO for 10 years.
Okay.
And so I work with them on putting the solutions together. I didn't want to give the impression that I was doing all of it. And then the University of Dayton students, University of Dayton marketing students who have had the digital marketing course that I'm actually doing a guest lecture in next week, talking about some of this stuff. And they're very happy to have a paid internship to get some things on the resume to hopefully do some of the stuff in the future. So those are the folks that are doing a lot of the work.
Yeah.
I'm doing the meeting with the business owner, coming up with a plan, and getting things kicked off.
So yeah, okay, good. Thanks for clarifying. I don't think anybody was going to challenge your web development resume or anything. I know that's not about adding bullets to the resume for you as much as it is just helping and hobbying, right?
Right, exactly. Mm-hmm.
So I wonder what are you going to get into next, man? You've gone a few different directions.
That's probably all I got time for.
That's all your wife can tolerate at this point.
Yeah, exactly.
Well, you kind of hit a lot of spots that I've worked in. I worked for a large Medicaid administrator in town here, and so kind of the paying for outcomes thing was just starting when I was last year there. Then obviously social kind of impact based or social determinants of health obviously is a real sensitive thing that you're working on that I think everybody cares a lot about. Nobody feels like that, disadvantaged. That kind of speaks to me too, because I grew up on food stamps and I've stood in a couple of bread lines and that kind of thing as a kid.
Mm-hmm. Yeah.
It's some of those programs, obviously much more, much less data was involved in those programs when I was a recipient of those things in California.
Oh, wait, speaking of CareSource, one thing and that's something else I'm working on. So I'm on the board of Ascend Innovations, which is a local company that is owned by the local health systems.
Right.
And so one of the things that Ascend is working on is an application called Positively that is aimed at high school students for them to feel comfortable reaching out when they're having some behavioral health crises and asking questions.
Interesting.
And CareSource has invested in that because they see that as innovative, and as they're bidding in other states to become that's a resource they can bring to that's a resource that they can bring to market.
That's intriguing.
So that's something else really cool. And
who's building that? Like who's in charge of it?
Ascend. Yeah.
Like who person?
Who person at Ascend?
Yeah.
Well, Matt Vreiser has been involved in that. They hired someone else recently who I've met. Something cool about Ascend. It's also cool to talk about Dayton. Yeah. And also bringing in my Air Force history here is one of the many cool things about Dayton, and the reason I'm proud to call it my adopted home, is there are so many super smart people here in Dayton because of the Air Force Research Lab and what's going on there. So a lot of your tax dollars go to, the Air Force focused on how do we bring technology and not only make the Air Force better, but what are some things we can invest on that can then also translate into commercializable things in the private sector.
Yeah.
And so in my last 5 years in the Air Force, when I was in DC, where a lot of people, finish out their military career, I was doing acquisition and some science and technology stuff within the medical field. Okay. Similar to what the 711 Human Systems Wing is, which is the sort of kind of the medical part
what they're doing
research lab. Yeah. Right. But there are so many crazy smart people that came out of that. And then, like my wife and I decided to actually make Dayton our home. We were stationed at Wright-Patterson, had been earlier in my Air Force career, but stationed at Wright-Patterson. And, the joke about Wright-Patterson is young single people in the Air Force, they're at Wright-Patterson and the Air Force says it's time to move on. They're like, okay, well, send me someplace more interesting than Dayton, Ohio. People with families, when it's time to move on, they say, wait a second.
Can we just
my spouse and kids don't want to leave.
Yeah.
what remote assignment can you send me on so my family can stay here?
That's interesting.
And so my wife and I didn't do that exact thing, but we moved on, did a couple other assignments, finished up in DC. I retired from the Air Force, and we made so many great friends here.
Mm-hmm.
We said, and our daughters were elementary age, and we said, let's go back to Dayton.
Yeah.
But they're through my both Air Force connections and just friends and business connections. I've met so many like genius level people working on things that sort of cross the government sector and the private sector. And because of my background, I understand both of those worlds and how things work in those worlds. And so there's a whole way of getting funded on the government side, and there's a whole way of getting funded on the commercial side. A lot of people don't understand both of those worlds, and they try to cross, and they don't really understand how that works. You know, what do you mean I got to wait 2 years to get the government contracts? You know,
I know,
but
just enough about
that SBIR contract that you're going to get is Small Business Innovation Research. Can fund some really cool things. I've also heard of them funding some sort of dumb things, but mostly they fund cool things that can turn into commercializable.
Between the base, defense, healthcare, and the startup community, that's kind of the world that I live in these days.
Yeah,
and all of them are really funded in unconventional ways, I guess, not by consumers buying stuff. You got venture capital, you've got kind of insurance, and then you've got government-funded programs and very complex acquisition processes. But for whatever reasons, my executive search business is kind of thriving in those three pockets. So it's kind of funny. You and I are
Eds, Meds, and Feds, right? By the way, that reminds me, I've got another guy for your podcast.
Oh yeah, good. It's always fun to have new faces, and I love getting better acquainted with people I know and have known for a while, like yourself, and then. On a couple of occasions now, I've had people in here that I've met them here, and that's really fun too. So, because then you're really kind of approaching the conversation with complete naivety, and just it's curiosity leads the way, right?
Right.
Well, thank you. For the sake of time, we got to cut it short. We could go on for hours, and hopefully we will. There's plenty more cocktails in the basement. Thanks for being a guest on the show, and we'll maybe we can do it again after the law's passed, and
there you
give us an update on the project.
We'll have a victory party for ranked choice voting. Sounds good.
Thanks, JD. Appreciate you, man.